The Mealtime volunteers are ladies, or indeed gentlemen if you care to volunteer, who come into the ward and assist the nurses to do their tasks and duties round about meals, i.e. filling out menus, delivering the trays to and from the patient, arranging the food so that the patient can independently eat, taking lids off juices, cutting up food. There is no responsibility to feed the patient because that takes us into a more complex area. There's lots of different tasks that they do, and also there's a social aspect to it. They'll spend time with the patients that perhaps they don't get at meal times, and it helps to relax them and gives them a better experience.
I decided to become a volunteer because I thought it was time I did something rather than being in the house every day of the week. I decided upon the NHS because I wanted to give them something back for the many operations I've had in the hospital here, and the staff were so good, and I just wanted to, as I say, give the hospital something back of my time.
The Mealtime volunteers have a massive impact on staff time and staff morale, actually. They know that they've got that little bit of assistance at the most. Some of the busiest times in the day are meal times. A lot of our patients require double up nursing.
It has got me meeting people, socialising better with people, and I just enjoy it.
The impact on the families is that the patients have had a more relaxed meal time because the nurses don't feel as rushed, so the patients perhaps don't feel as rushed. So the visiting time with the family is more valuable because the patient's in a better frame of mind and a better state of well-being. From patients, they love that the volunteers come in because it gives them a different perspective. It's not another uniform, so the patients enjoy seeing somebody different. A lot of times it's a familiar face as well because they're the same generation, and it's wonderful to see the interaction and that relaxed, conversation.
The banter's good between us, and it just, as I say, a fresh face, somebody who's not in a nurse's uniform, and a smiley, friendly face is good for them. Sometimes you get them to talk about their life and what they've done, and it can surprise you what they've done and the amazing things that they have done in their life. And sometimes I think people forget that people of that age have had a life and have done things, interesting things, and it's nice to hear them.